So patients ask me all the time, like, what can I do to make my eyes healthier? Should I be eating more carrots? Should I be taking special vitamins? Well, let's talk about some of that. So I think the best thing that you can do if you're concerned about your eyes or your ocular health in general is just go to an eye doctor. Like, get a formal exam, get a dilated exam, make sure someone has a chance to look at the eyes. That tells us not just about the eye itself, but other parts of the body as well. A basic eye exam. Just the other day, I had a patient who was diabetic and he had ocular disease on one eye and not so much in the other eye, and I was preparing him for cataract surgery, and I was like, you know, it's unusual to have a systemic problem like diabetes affect one part of the body more than another. You should probably see a cardiologist, just make sure that there's nothing going on with your blood flow to your eyes or your brain. And sure enough, he had a carotid ultrasound and a CTA or an angiogram of his brain, and he did have some blockage in one part of his neck that could have resulted in a stroke down the road. So every once in a while, you catch things that you don't expect, and getting in an annual exam is really important for anyone 40 or over. That's a time where most people lose some of their reading vision, time where they start thinking about getting their eyes checked. Always a good idea, but definitely anyone 60 or over should get an exam every year. Before I continue, I want to take a brief moment to pause and thank you for your time. And if you're enjoying this content, please like and subscribe to learn more about the eye and eye health and things that modern eye practices can do to help you see better. So yeah, getting your eyes checked is really important, but what about carrots? Should you just be eating more carrots? If you like them, you can, but they're not really going to be the game-changing solution for all your eye problems. And that's because beta-carotene, vitamin A, omega-3s, all these important elements of our nutrition that are shown to be important when it comes to your eye health overall, you're going to get a lot of that naturally just by having a well-balanced diet. You don't necessarily need to focus on specific foods or vitamins unless you have macular degeneration. There are specific vitamin types, specifically AREDS2 vitamin formulations that are designed specifically for protection of the macula and the retina for that particular type of disease and problem. But for the average person, even someone who has a family history of macular degeneration, you don't need to start those vitamins early. Just wait till the doctor prescribes it and recommends it specifically based on their findings. Now, with that said, having a multivitamin with a lot of those ingredients is certainly helpful, but coincidentally, the AREDS2 supplements that I mentioned for macular disease and macular health, they do not have beta-carotene, which is found in carrots. So there are reasons that you don't just take things because you think you've been told that that's healthy. It turns out when they made AREDS1 and reformulated to AREDS2, they found the beta-carotene was actually not helpful and in fact harmful and contributed to other problems in the body that they took out of that supplementation. Now, omega-3 supplements have been shown in some patients to be helpful in repopulating the meibum in the oil glands on the eyelid, which prevents evaporation. So increasing fatty acid consumption, whether it's fish or omega-3s, can be helpful. Vitamin C has also been shown to be helpful in healing and epithelial health with the skin layer of the cornea. We often will increase our vitamin C supplementation for patients who've had eye surgery. So there definitely are other things that you could consider that are available widely and can certainly be helpful for the eye. Yeah, basically, you know, just a general multivitamin can also be helpful. Something over the counter, something age-specific can also be nice. But again, spending extra money on ocular health supplements, I haven't found to be helpful for most patients. But in general, the best thing you can do is get an eye exam, make sure there's nothing going on that you're not aware of, and then follow your doctor's recommendations that are specific to you. So thanks again, and I'll see you in the next one.